Have you ever left the house, gotten halfway down the street, and suddenly been hit with a wave of doubt? Did I lock the door? Did I leave the stove on? Sure, most of us have, but imagine that a thought doesn't just pop in and leave. It sticks. It grows close. It starts screaming at you. You definitely left the stove on. Your house is going to burn down. It will be all your fault. Your family will die, and the only things that quietens that scream, even for a second, is to go back and check. Not once, not twice, but 7, 8, 10 times. That right there is a small glimpse into the world of Obsessive-Compulsive Disorder, or OCD. And spoiler alert, it has almost nothing to do with liking things clean and organized. Welcome everyone, I'm Dr. Jamalvandi, and on this channel we break down complex medical topics into simple, understandable information. If you're new here, consider subscribing and hitting that bell icon so you don't miss our future videos. And if this topic resonates with you, a like on the video always helps us reach more people. Today, we are diving deep into OCD. We're going to shatter the myths and uncover the reality. We'll answer what OCD truly is from a medical perspective, how to know if it's just a personality quirk or actual OCD, the real evidence-based ways it's treated, and what you can do if you or someone you love is struggling. This is a conversation that's long overdue because misunderstanding this disorder can prevent people from getting the help they need. So let's get started. What OCD really is. So let's get the textbook definition out of the way. OCD is a mental health condition characterized by a cycle of two main components, obsession and compulsions. Let's break these down. First, obsessions. These are not just thoughts you can't stop thinking about, like a catchy song. Obsessions are unwanted, intrusive thoughts, images, or urges that repeatedly pop into your mind. The person with OCD does not want these thoughts. They cause intense anxiety, fear, disgust, or doubt. The person knows these thoughts are a product of their own mind, but they feel uncontrollable and terrifying. What kind of thoughts? They often fall into them. Fear of contamination, not just germs, but maybe chemical, radiation, or even bad luck. Fear of harm. What if I stab someone with this knife? Or what if I push someone in front of a train? These are called harm OCD and are incredibly distressing. Sexual obsessions means unwanted, taboo sexual thoughts that go completely against the person's character. Religious or moral scrupulosity, a crippling fear of having sinned or having blasphemous thoughts. A need for symmetry or just right feeling, a sense of intense discomfort if things aren't perfectly even or arranged in a specific way. This is the most important thing to understand. Having an intrusive thought does not mean you want to act on it. In fact, the thought is so horrifying precisely because it's the opposite of who you are. The brain of someone with OCD gets stuck on a false alarm. Now, to deal with this tsunami of anxiety, the brain desperately looks for a way out. And that leads to the second part of the cycle. Second, compulsions. These are the repetitive behaviors or mental acts that a person feels driven to perform in response to an obsession. The goal is to reduce the anxiety or prevent a dreaded event. But, and this is the cruel trick of OCD, the relief is only temporary. Compulsions can be visible actions. Washing hands until they're raw, checking the lock 15 times, arranging items in a specific ritualized order, tapping, continuing, or repeating words, or they can be hidden mental rituals. Mentally reviewing events to be sure you didn't make a mistake. Praying silently to cancel out a bad thought, replacing a bad image with a good one. Seeking constant reassurance from friends or family. Are you sure I'm a good person? This, my friends, is the OCD cycle. Obsession can lead to anxiety, then compulsion, then temporary relief, then obsession returns. Even stronger, it's an exhausting trap. When is it a quirk or when is it OCD? So how do you know if you're just a neat person or if you might have OCD? The key lies in two words: distress or dysfunction. The World Health Organization lists OCD as one of the top 10 most disabling illnesses. That's not an exaggeration. Ask yourself, do these thoughts and behaviors take up more than an hour a day? About distress, do they cause you significant mental anguish, anxiety, or fear? About functioning, do they interfere with your work, your social life, your relationships, or your daily functioning? If the answer is yes, then it's not a personality quirk. It's a disorder that deserves attention and, most importantly, treatment. It's not about the behavior itself, it's about the reason behind the behavior. Organizing your bookshelf because you like it is a hobby. Organizing it because you're terrified something terrible will happen to your family if you don't is OCD. How to break the cycle? Now, for the most important part, OCD is highly treatable. You are not stuck in this cycle forever. The gold standard for treatment is a combination of therapy and, in some cases, medication. Therapy, exposure and response prevention, that means ERP. This is the most effective form of therapy for OCD. It sounds intimidating, but it's incredibly powerful. This means gradually and safely confronting the thoughts, images, objects, and situations that trigger your obsessions and anxiety. For someone with a fear of contamination, this might start with touching a doorknob. Response prevention. This is the crucial part. After the exposure, you voluntarily choose not to engage in the compulsive behavior. So after touching the doorknob, you would resist the urge to wash your hand. ERP works by teaching your brain a new lesson. Right now, your brain has learned. See a trigger, feel panic, do a compulsion, feel safe. ERP rewired that to see a trigger, feel panic, sit with the anxiety, and watch as the anxiety naturally decreases on its own. Without the compulsion, you are literally building a new mental muscle. Medication. Selective serotonin reuptake inhibitors or SSRIs are a type of antidepressant that are also very effective for OCD, often at higher doses than for depression. They help to regulate the brain chemistry involved in the OCD cycle. Medication can be a lifelong, making the anxiety manageable enough to engage effectively in therapy. Be careful that you can't use medication by yourself, and be sure that you should go to the doctor and your doctor should choose your medication. Lifestyle and support. Education. Understanding your enemy is half the battle. You are not your thoughts. Mindfulness and acceptance. Learning to observe your obsessive thoughts without judgment, like clouds passing in the sky, rather than fighting them. Support groups. Connecting with others who truly get it can be incredibly validating and reduce the shame. A quick word on prevention. We don't know how to prevent OCD, as its cause are a mix of genetics, brain structure, and environment. But we can prevent the suffering. Early diagnosis and intervention are key. If you see the signs in yourself or a loved one, don't wait. Reach out to a mental health professional. So let's recap. OCD is not a personality trait or a desire for cleanliness. It's a debilitating cycle of unwanted, intrusive obsessions and ritualistic compulsions done to quiet the anxiety they cause. It's a real medical condition and it is treatable. If you took one thing from this video, let it be this. Having a bad thought does not make you a bad person. It's your reaction to that thought. It's your reaction to that thought that matters. There is zero correlation between intrusive thoughts and actions. If this video helped you understand OCD better, please give it a thumbs up. It really helps the channel, and if you haven't already, subscribe for more clear, compassionate explanation of medical topics. Most importantly, if you see yourself in this description, please know that you are not alone and you are not broken. Your first and bravest step is to talk to someone. A psychiatrist or a therapist trained in ERP can change your life. Share this video with someone you think might need to see it. Let's spread awareness and reduce the stigma one conversation at a time. Thank you for watching. I'm Dr. Jamalvandi. Take care of your mind and I'll see you in the next video.